Structural racism is hurting us badly in this country, in the state, and in Cuyahoga County. Of course, it's most directly harming people of color, but it hurts everyone. When some of us are kept down, we're all held back. Racial inequities have been highlighted by the pandemic. Black and brown people are getting infected, going into the hospitals, and dying at far greater rates than white people. We recently declared racism as a public health crisis. This declaration addressed all of the complex and interrelated effects of inequities. The county then stood up two commissions. One focused internally at county government, led by senior administration leaders, and the other focused on the community at large, led by a group of civic leaders. Both were tasked with looking at the root causes of inequity and how the county is addressing those. I've recently received initial reports from both, and I want to acknowledge the hard work that went into both those reports. They made a series of recommendations, and I am committed to following through on them. First, the county is committed to providing racial equity and inclusion training for all of our employees so that we all share a common understanding of racism and how it manifests itself both obviously and also unconsciously. Second, we're proposing legislation to create an Office of Diversity, which will focus immediately on our procurement policies and practices. The director will be a cabinet-level position. The county contracts with a lot of companies and people, and we want to make sure that all qualified businesses and individuals get a fair shot at doing business with us. We know that access to business is one of the things that's unequal through our community. The county's committed to seeing that change. Third, we're proposing legislation to define equity zones. These zones will be focused on areas where there are significant disparities in income and infrastructure. I've directed all my departments to take a look at the services that they provide and to make sure that we're giving these equity zones more focused consideration. A good example of how this can work is in our Public Works Department, where we recently announced our 2021-2022 road projects. When we decided where we would locate our projects, we took into account the economic health of that community based on a community's percent of households in poverty and average annual household income. Many of these communities also have higher levels of African Americans and Latinx people in them. So with the $17 million that we had for road improvements, we were able to propose important projects in Bedford Heights, Broadview Heights, Cleveland, Cleveland Heights, East Cleveland, Euclid, Maple Heights, Mayfield Heights, South Euclid, and Warrensville Heights, among them. Another example is our tree canopy work. Here we have a grant process where communities can apply to plant trees to improve their local climate and health conditions. Part of our decision in awarding these grants is the Vulnerability Index, which also is closely related to the economic health of a community. And our Department of Development has a long-standing policy of making sure that our business supports go to a high percentage of minority-owned businesses. We know that a higher percentage of Black-owned businesses were hit by the COVID economic crisis. Nationally, 44% of Black-owned businesses were closed compared to 17% of white-owned businesses. Locally, we worked to do better. Almost 60% of our small business stabilization grants, for example, went to minority-owned businesses. And with our restaurant stabilization funds, almost 40% of those dollars went to minority-owned businesses. We're making some progress. Now I want to talk about vaccines. This pandemic is a killer, and it's still roaring. Right now, it's most important to get vaccines into arms. It must be done in a fair and equitable way. But sadly, that's not happening right now. Minorities, people of color, are not getting a fair share of the vaccines. According to the Board of Health, we're seeing that 90% of the available vaccines are going to white people. Now, this is happening for a lot of reasons. Most important, more African Americans don't trust the safety of the vaccine. And the vaccine has been tougher to get in minority areas. We must address those problems if we truly care about fostering equity. So today, I'm joining Dr. Sherry Williams, the Diversity Committee Chair of the Cuyahoga County Board of Health, to make asks to the federal and state governments. First, target vaccines to strategic locations in underserved minority areas with community partners, much like we did when we greatly expanded testing programs to underserved areas, which we did in partnership with the Board of Health and Metro Health. Second, use trusted messengers to encourage minority populations to get the vaccine when available. For example, church leaders would be good advocates in Black communities. And third, allocate at least 20% of the vaccines to reach communities of color. This is critically important. Right now, our County Board of Health is doing what they can. Last week, they partnered with the Word Church in Warrensville Heights to get out more than 500 doses, and we'll continue to do what we can. This is the kind of advocacy that we need to make sure that people are not left behind. I'm committed to putting our county resources behind advocating and reaching out to let people know where and when vaccines are available, to help dispel some of the concerns and myths that are out there about the vaccine, and to ensure an equitable distribution. As a reminder, people can call the 211 line and get help with their questions and get help with registering for an appointment. If you're a Cleveland resident, there's another number to call, and that's 216-664-2222. So county residents call 211, Cleveland residents call 664-2222. In addition, the county has a webpage at cuyahogacounty.us/vax, that's VAX, where you can see if you're eligible for a vaccine, see a map of locations where doses are available, and read about the facts, not the myths, behind the vaccine. We're also part of a local collaborative marketing task force that's working on messaging about the vaccine. This task force was brought together by the COVID Rapid Relief Fund, the Cleveland Foundation, the Gunn Foundation, and the Mount Sinai Foundation. And it includes community members and advocates, communications professionals, and others. This is a crucial effort for the health and safety of every one of us. We need to get as many of us vaccinated as soon as we can so that we can all be safe.